The use of exercise interventions to improve gait in Parkinson's disease patients. Background. Parkinson's disease is the second most common neurodegenerative disease, with its effects being progressive and irreversible, resulting in different motor dysfunction. The prevalence of neurodegenerative diseases such as PD increased majorly with age, with approximately 1% of people over the age of 60 years and an estimated 4% of people over 80 years suffering from this disease. The effects of genetic and environmental factors also contribute to its development. PD is known to affect the neurons situated at the basal ganglia level, and more precisely, the neurons of the substantia nigra which secretes dopamine. Due to the decrease of dopamine secretion, postural and motor deficits as well as functional incapacities are induced. Earhart et al. Stated that it has been repeatedly reported during the past 10 years that physical exercise constitutes an effective intervention in neurodegenerative diseases, attenuating or limiting their progression. Individuals suffering from PD typically display an impaired ability to walk and change direction, resulting in their gait being characterized by small shuffling steps, stooped posture, and reduced arm swing. As an individual's PD progresses, these bodily movements exacerbate and gait impairment increasingly worsens. However, some studies have shown that vigorous exercise in midlife can significantly reduce an individual's risk of developing PD in the first place. To add to this, exercise has also been found to be associated with increasing lifespan, physical functioning, health-related quality of life, strength, balance, and gait speed in PD sufferers. Therefore, it is a viable assumption that if exercise is involved in decreasing the risk of PD, then it is possible that it may also help to slow the progression of this motor dysfunction caused by this disease. This review aims to thoroughly examine the current literature on the effectiveness of exercise improving gait in people with PD, whilst also comparing which specific exercise interventions are more beneficial, including land-based, water-based, self-directed, or clinic-directed. Methods. In order to obtain the most widespread review of literature as possible, a number of different online databases were used, including PubMed, Scopus, Google Scholar, and SportDiscus. Each of these databases were accessible via the CQ University online library and allowed for specific search terms to be used. To ensure the articles found were as valid as possible, the exclusion checklist on the side of each database was used. This involved ticking boxes such as peer-reviewed, free full text, and published in the last 10 years. Specific keywords related to the topic were then identified to be search terms. The terms that were primarily searched were exercise, Parkinson's disease, gait, and exercise intervention. Though, as the need for more information on more specific exercise interventions arose, the search terms land-based, water-based, self-directed, and clinic-directed were also used. No exclusion words were applied to the searches as it was not deemed necessary, as no irrelevant articles seemed to appear with the chosen search terms. However, the inclusion word "and" was used regularly. Findings. This review of literature incorporated information from 11 different articles related to the topic of the effectiveness of exercise improving gait in PD people. According to the many sources, it is a well-established fact that exercise is a very useful therapy in managing and improving gait impairments in PD. However, a study by Ayan et al. Looked specifically into the effectiveness between land-based and water-based exercise, with results showing that whilst land-based exercise is beneficial to improving gait impairment in PD patients, water-based exercise sessions being added to the therapy was of no great benefit. Conversely, a recent review of the literature and a pilot study on the effectiveness of water-based exercise in PD patients revealed that this modality of therapy does in fact have some beneficial outcomes for patients, including improving their motor symptoms, functional mobility, and balance. However, it was clearly stated several times that there is currently a definite lack of research and proven information on this topic. Whereas the effectiveness of land-based exercise intervention on PD patients was a well-covered research topic, with many articles discussing its benefits and no articles opposing such information. The search for articles related to general land-based versus water-based exercise therapies in PD patients displayed the lack of research that has been performed on this comparison, as there were only a couple of articles to be found. However, there were many articles that looked at more specific land-based exercise therapies on gait, such as progressive resistance training, treadmill training, and Wii Fit balance board therapy. Numerous studies reported that a variety of land-based exercise interventions can be beneficial in improving the effects of PD on gait impairment. According to Park et al., these include home-based exercise, treadmill training, resistance training, dancing, Tai Chi, and robot-assisted gait training. Many of these exercise interventions can be self-directed as they are safe to perform slowly and at various levels of difficulty. The amount that an individual's PD has progressed plays a major role in what exercise intervention will best suit them. Some patients with further progressed PD symptoms may only be able to perform clinic-directed exercise due to safety reasons. Discussion. As evident by the findings discussed earlier, the results of this literature review reported some controversial information, particularly in regards to the effectiveness of water-based exercise therapies in people with PD. One article found that water-based exercise therapy was of no real benefit to PD patients, whilst a review in the same year discussed the improvements other studies had reported from this therapy. This controversy is likely due to the limited number of studies on this particular exercise intervention in Parkinson's patients. The studies that reported improvements in motor symptoms, functional mobility, and balance due to water-based exercise frame the assumption that this modality of therapy is likely somewhat useful in improving gait in PD patients, as the areas improved are main factors that contribute to stance and general walking movements. However, clearly more research is needed on this exercise intervention in PD patients, and specifically the effect it has on gait, to be able to prove this assumption correct. When observing results from studies based on the general effectiveness of land-based exercise interventions on PD patients, it was a clear conclusion from all sources that it is in fact beneficial. The studies that looked at certain types of land-based exercise interventions on gait also displayed positive results. For example, the results of a study by Haas et al. Implied that progressive resistance training could potentially be an effective way to enhance gait performance by developing a more efficient anticipatory postural adjustment and improved spatiotemporal parameters of initial step. In Haas et al.'s study, this was achieved by strengthening participants' trunk and lower limbs with progressive resistance training, as weakness in these areas only further exacerbates the gait impairments in PD patients. These results supported other studies' findings that have stated exercise to be a safe and effective modality to improve both physical abilities and quality of life in people suffering with PD. Therefore, due to the lack of research on the topic of water-based exercise interventions in PD patients, it would not be fair to directly compare this therapy with land-based exercise that has been so well covered and tested in many studies. However, if a decision had to be made as to which therapy modality is more effective at improving gait, the general consensus of literature suggests that land-based exercise would be more beneficial. This is for the pure fact that there were no studies found to oppose its benefits in improving symptoms in PD patients, particularly gait, whereas there was one article opposing the effectiveness of water-based exercise therapy in PD patients. Conclusion. Overall, this review of the literature has been effective in establishing that exercise is effective in improving gait in people with PD. It also concluded that general land-based exercise interventions of many types are of great benefit to improving the effects of PD, whilst the use of water-based exercise interventions are still slightly questionable, as more research is needed in this area. When looking at exercise interventions as a whole, the general consensus is that self-directed exercise is appropriate, unless in severely progressed cases of PD, in which clinic-directed exercise would be more suitable.